Namaskaram everyone. We are again here with a new video related to the ovarian cyst. In this video, we will be discussing the often overlooked topic of ovarian cyst, which can pose a significant risk to women's reproductive health. We will explore the different types, causes, symptoms and treatments available. If you or someone you know has unexplained symptoms, so stay tuned, let's dive in. First of all, if we want to understand the ovarian cyst, we have to have the idea of female reproductive system. Here in this picture, you can see the different organs of female reproductive systems. We will start with the ovaries. There are ovaries connected to the fallopian tubes, and then it comes to the uterus, then cervix and vagina. The ovaries produces and releases eggs or ova and hormones including estrogen and progesterone. The fallopian tube connects the ovary to the uterus and a site of fertilization where the sperm can meet and fertilizes an egg. The uterus is a muscular organ where a fertilized egg implants and grows during pregnancy. It also sheds its lining during menstruation if pregnancy does not occur. The cervix is the lower part of the uterus that opens in the vagina. It plays a role in keeping the uterus closed during pregnancy and dilating during childbirth. And lastly, the vagina is a muscular canal that connects the cervix to the external genitalia. It serves as a pathway for menstrual blood, sexual intercourse and childbirth. So with this idea of female reproductive system, now we can understand the ovarian cyst better.
Women's reproductive system can experience various health issues like endometriosis, PCOS, STDs and cancers. Maintaining reproductive health is very crucial. First of all, we will talk about the most overlooked condition of female reproductive system, that is ovarian cyst. And cyst is not but the swelling or a lump filled with liquid in the body or under the skin. So understanding of different type of ovarian cyst is very much important as they can be asymptomatic, leading to delayed diagnosis and now treatment. Let's discuss briefly about type of ovarian cyst. Here in this picture, you can see on the left hand side the normal ovary, the ovary without a cyst, and the right hand side ovary with cyst. You can see the outgrowth of the cyst over the ovary. So these are the different type of ovary. So you just note the names of this: polycystic ovary syndrome, dermoid cyst, cyst adenoma, endometrioma, follicular cyst and corpus luteum cyst. What are these? These are actually the common type of cyst of female reproductive system, in which the PCOS is the most common. Normal ovaries produces follicles which later on matures to form an egg or ova. But in PCOS, these follicles of ovaries grow numerous small fluid-filled sacs or cysts that obstructs the production of egg or ova. Other type of cysts which are unrelated to menstrual cycle includes dermoid cyst, which is a form from embryonic cells or may contain fetal tissues. Second is cyst adenomas. It develops outside the ovary and contains a type of fluid. Endometrioma result from the endometriosis that can lead to formation of cyst. The functional cysts are of two types. First, follicular cyst. Second is corpus luteum cyst, in which the follicular cyst occurs when the follicle in the ovary doesn't rupture or release an egg and grows until it becomes a cyst. Then corpus luteum cyst is a harmless fluid-filled mass that originates in the ovaries. So after knowing all the types of ovarian cysts, now talk about the common signs and symptoms. While most ovarian cysts are harmless and may go away on their own, but larger cysts can cause symptoms such as pelvic pain, bloating, fullness, pressure in the stomach and dullness or sharp pain in the area below the belly button, especially on one side. While PCOS may cause acne, mood swings and depression. Now let's talk about what the ruptured ovarian cyst may feel like. Ruptured ovarian cysts require immediate medical attention and can cause sudden and severe abdominal pain, fever, vomiting, breathing problems, weakness, lightheadedness, and cold and clammy skin. Now let's talk about who are at risk. No way to predict who is more prone or less prone to developing ovarian cysts. Risk factors include hormonal problems, pregnancy, endometriosis, severe pelvic infections, and previous cases of ovarian cyst. So you should be take care of these risk factors. So that is why the early diagnosis is the key. Ovarian cysts are mostly asymptomatic in early stages. So regular screening is recommended. Pelvic examination and imaging tests such as pelvic ultrasound can help detect ovarian cyst. The treatment plan depends on the size of the cyst. Early diagnosis is important for better health outcomes. Thanks for watching. Subscribe for more such videos.